So, great afternoon, one and all. This is Dr. Archana Harish, launched by Himaja Anil, coaches are Murthy sir and Alekya. Today, as a part of health topic, let's discuss about heart health and how all the other nutrients also plays a major role in combination of heart health. So, hope my skin is visible to one and all. So, let's know before starting what is atherosclerosis. So, whatever the things which are piling up on the inner lining of the blood vessels, especially which is containing more amount of cholesterols, fats, especially this triglycerides, I can say, and even some calcium deposits in together, we are calling it that as atherosclerosis. So, because of that, we have the blood have to squeeze while passing out. So at times in the starting stages, it will lead to some mood fluctuations or some migraine, headache issues, and all. Slowly, you will end up in high blood pressure or hypertension, and even it might result in heart failure. And also, that once that plaque is getting ruptured, it will go and block to small or the minor arteries that is supplying to the entire body, which may also cause cardiac failure. So now, what are the other elements that can help in preventing this atherosclerosis? Let's look into this first element, that is nitric oxide. So most of us might also have taken some sedation, mattu, maybe the general anesthesia or in the local anesthesia. Nitric oxide is one of the common elements. So it helps in relaxation and widening the blood vessel. So whatever there is a constriction, right? This nitric oxide will help in widening this blood vessel. So, any clot formation or any inflammation in the cells also can be prevented by this nitric oxide. So, it is usually present in green leafy vegetables, and L-arginine is one of the amino acid which is the precursor of nitric oxide. So, all the healthy foods which are rich in protein, or I could say amino acids of L-arginine, are helping for our heart health. So that is found especially in our nuts, seeds, and meat. So all these things will help you in widening the blood vessels. And next is magnesium. So magnesium and calcium maintain the electrolyte balance in the cell, which is the intracellular and extracellular ions, I could say. So once this ionic balance is maintained, the heart will beat in a easy and uniform rhythm. The heartbeat, we call it, right, 70 to 100 beats per minute, we are calling. If anything more than that number, we call it as arrhythmia, or the more number of the beats per minute, we call it as arrhythmia. So that blood pressure and heart rhythm is maintained by this magnesium. And any calcification because of this calcium, more calcium deposits can be prevented by taking this good amount of magnesium in our day-to-day routine. So, pumpkin seeds, almonds, spinach, or any green leafy vegetables are very good sources of this magnesium. And next is vitamin D and heart health. So, vitamin D plays a very major role in calcium metabolism, and it reduces the inflammation in the artery. We have already seen in the omega book, the inflammation will actually causes the clumping of all the cells together, leading into the blocks or some atherosclerosis. So this vitamin D will reduces the inflammation, and also it regulates the calcium metabolism. So it will help in more bone formation, reducing that calcium deposits in the blood vessels. So deficiency of this vitamin D will lead into arterial dysfunction. There will be no proper functioning of this arteries, which will carry pure and impure blood. So there are more risks for our heart diseases. So where can we get this vitamin D? Yes, obviously from sun exposure, but we all know that that only source will not give you this sufficient amount of vitamin D. So foods which are rich in fatty fish, eggs, and also vitamin D supplementation will help us to maintain proper heart health, so that it prevents the calcification of this atherosclerosis. And next is role of testosterone in heart health. We all know that testosterone will always induce or accelerate the muscle formation, or it helps in the vascular function. So whenever there is deficiency in testosterone, the arteries will become stiff. There is no contraction and relaxation of the muscles present in the arteries. Even all the wall of this arteries contains the muscles. So that muscle will not contract or relax. So it will become stiff. Not only in the heart, everywhere in the body, if testosterone is less, there will be muscle stiffness or arterial stiffness. So once the artery is very stagnant, it will accumulate more and more fat, and there is no cleansing activity also. So again it will lead into more atherosclerosis. So optimum maintenance of testosterone is very important for vascular function, and nitric oxide for vasodilation, it is very important. So testosterone is very rich in zinc rich foods or pumpkin seeds, I can say, and vitamin D foods, healthy fats, that is omega 3 rich foods. And we can also improve this testosterone by doing some resistance training, some exercises in the gym which will help you to boost up this testosterone along with healthy food. And vitamin K2, the artery protector, I can say. So we have seen that whenever there is more calcium, that will lead into calcification wherever it might be. So we need more calcium in the bone. So if the more calcium is present in the blood vessel, it will start calcifying, and that calcium deposits wherever, if it is going through this block, again it will worsen this atherosclerosis. So calcium, if it is present along with vitamin K2, vitamin K we call it as anti-clotting factor. So this vitamin K will not help in clotting the cells. It is used in so many blood thinners also. So once this calcium is taken along with vitamin K2, it will prevent the calcification of arteries or atherosclerosis, and it helps in deposition of more and more calcium in the bone, so that we can work with bone strength and also this immunity also. Yeah. So sources of this vitamin K2 we get in fermented some soya beans, cheese, and dairy products. And next, coming to the effect of zinc, that is related to the heart health. This is very important. Each and every cell in our body will undergo oxidation. So even if you have seen apple, if it is cut after some time exposed, it will turn out the color because of oxidation. So even the cells, each and every cell in the body, because of the toxins or because of the aging process, it will undergo this oxidative stress. And obviously because of the repair mechanism, inflammation will also is going on in our body every day to day. So because of that oxidative stress and inflammation, there are so many inflammatory products and toxic products released into our body. So this zinc will help in reduction of this oxidation stress and also this inflammation in our body. And it helps in production of more testosterone and nitric oxide. We have seen that testosterone is helpful for movement of arteries, and also it prevents this artery calcification, whereas this nitric oxide will help in vasodilation. Okay, so zinc will help in all these functions. So the beautiful source of zinc is from pumpkin seeds, oysters, some meat, and lentils. So now, if you have seen all the factors, these are few major nutrients which will help in the heart health. So if you see, one amongst all these common is pumpkin seeds. Yes, it is a heart superfood because it is very high in magnesium. So it maintains the proper blood pressure. So it will not help in calcifying this blood inside the arteries. And it is rich in zinc. So zinc will boost more nitric oxide and reduces the inflammatory process, and even it reduces constriction of the blood vessels. And it contains omega 3 fatty acid. Of course, it is a vegetarian source. It contains ALA, alpha linoleic acid, but the conversion of alpha linoleic acid to EPA and DHA, the useful amino acids, is very less, maybe up to 1 to 10%, but at least it is containing that precursor, or at least 1 to 10% it is helping by containing this omega 3 essential fatty acids, so that the bad cholesterols, especially the triglycerides, will be reduced by taking this pumpkin seeds. And it is a super good antioxidation. It is packed with antioxidants, I can say. So it reduces the oxidation stress and also inflammatory process, so that the arteries will not constrict or get blocked. And it contains some phytosterols. So phytosterols are nothing but again antioxidants, I can say. Vitamin E and vitamin C, these are the natural antioxidants. That's why intake of good amount of vitamin C and also this vitamin E rich pumpkin seeds and all the other nuts and seeds will lower the bad cholesterols in our body and reduces the risk for our heart health. So overall, I can say that including this pumpkin seeds in our day-to-day routine is very important. At least try to have 2 to 5 teaspoons every day, or ask your coaches. Definitely, they'll suggest you, and which will help you for maintaining the heart in a very healthy way. Thank you.